So welcome back. Don't go broke in a nursing home. We don't want this to be you or your family. And it's not a joke. What we see in our practice is that the threat of long-term care costs is the biggest risk for most families in Tennessee. It's not taxation. It's not creditors. It's not the risk of that divorce of one of your children. Those are all relevant questions that our clients ask us, but it's the elephant in the room, which is what? The cost of care is astronomical. It can be $10,000 to $15,000 depending on if you're receiving care at home, at a private care home, or a skilled nursing facility. The cost can be anywhere in those ranges. It's very expensive, and lots of people really are concerned about how they'll pay for it. Now, a couple of myths that I want to dispel up front. Medicare does not cover long-term care. So many folks think that your Medicare is going to cover the cost of care, or that your Medicare Advantage plan or your Medicare supplement will cover care. That is largely not true. Okay, Medicare will cover roughly 100 days of a hospitalization or 100 days of a stint in a nursing home or a rehabilitation center based on, honestly, the treatment plan, the course of recovery, and the doctor's orders. After that 100 days, how do we pay for care? And there's three options. Number one, we can privately pay with our assets. Number two, a long-term care insurance product can be activated if you qualify at that time. And number three is Medicaid can cover the cost of that care. Okay, and so because of these risks, clients are so concerned. Okay, so my Medicare supplement, what about my home health aid that I have? If I'm coming home, after a surgery, that paid for my spouse's care after open heart surgery or after cancer. That's different. Okay, that is a home health aid benefit that is tied to something that Medicare covered, like that surgery. Okay, that's very limited in scope. That's not long-term care. Okay, that's not 20 or 30 hours of care at the home. And so option three is the default for so many Tennesseans because they do not have a long-term care insurance policy and they do not have the funds to private pay for an extended period of time. Now, we want to talk about how do we preserve assets in the overall estate planning process when we're healthy and of sound mind. And there's a variety of ways we can consider doing that. One of the big instruments that is ethical, legal, and is a great tool in our arsenal is the Medicaid Asset Protection Trust. Okay? And if you're interested in that, there's lots of specifics, but here's how it generally operates. We want to proactively plan for long-term care. We want to proactively plan for the threat of Medicaid needing to be activated to cover our cost of care. We want to get individuals' assets into that type of trust ahead of time so that we don't have to spin those assets down to become eligible for Medicaid. Now, what are some good assets to consider using in confidence with your estate planning professional, obviously, would be consider funding your trust with primary residential property, funding your trust with other hard assets like a farm or land or a cabin or something like that that you may have that you don't want to sell. Those assets could make Medicaid eligibility very difficult for you down the road. They're going to be counted against your resource limits. You may be forced to liquidate and sell and really start seeing your estate erode away before your beneficiaries and loved ones get the benefit of your hard-earned work. And so there is a really beautiful trust that we can set up called an asset protection trust. If done properly with the advice of an elder law attorney, okay, I want to make that clear. It can be structured in such a way as to preserve assets, okay? And we use those frequently. Now, before we kind of close our video, I want to talk about crisis planning. What about for those folks who did not proactively plan ahead of time? We want our pre-planning clients to think about planning 5 years in advance. If you're in retirement, if you're a new retiree, we want to plan now, okay, not in a crisis. But if we are in a crisis, what can we do? If you are a married couple and you are that spouse, call our firm immediately. If your loved one has had a fall, if they're in a rehab center, if their Medicare is running out, get on the phone with us. There are a variety of legal and ethical instruments and strategies that we can do to expedite eligibility for the spouse and retain the lion's share of the wealth and assets for the community spouse who's still healthy and at home. All right. For those that are single and are unmarried, okay, if this is maybe a parent, okay, that's going into a facility, call us, okay? Again, now in this situation, we're not going to be able to preserve all the assets that are exposed, but what we can do is come up with an asset protection strategy that's typically going to preserve at least half of the exposed wealth. So I hope on this video, to recap, We have dispelled the myth that Medicare is going to cover care. We have shown the enormous cost of care. And lastly, we've talked about some solutions, but you have to take action.